Hello everyone, this is Janhavi Gandhi and I welcome you to the fifth and hopefully the final take of this lecture.
Okay.
Where I talk about the blood supply of the brain. So I've divided this topic into two major parts, the arterial supply and the venous drainage, and I've also given you important clinical points wherever necessary. The blood supply of the brain is given by two major arterial systems, the carotid system and the vertebro-basilar system. Now, let's see where these two systems arise from. The arch of aorta gives rise to three major branches. The brachiocephalic trunk on the right side and slightly towards the left side is the left common carotid and the left subclavian artery. The brachiocephalic trunk gives two branches, the right vertebral artery and the right common carotid artery. On the left side, the left subclavian artery from its first part gives rise to the left vertebral artery. Now let's just quickly revise. On the right side, we have the right common carotid and right vertebral arteries directly arising from the brachiocephalic trunk. And on the left side, we have the left common carotid arising from the arch of aorta and the left vertebral artery arising from the first part of the left subclavian artery. Now, both the vertebral arteries travel in the neck via the foramen transversarium of the cervical vertebrae, and the arteries enter the cranial cavity via the foramen magnum. After they enter the cranial cavity, both the vertebral arteries unite to form the basilar artery at the lower level of pons. Now the common carotid arteries at the level of C3-C4, I repeat, at the level of C3-C4, branch out to give the external carotid arteries and the internal carotid arteries. Now our internal carotid arteries enter the cranial cavity via the carotid canal and they terminate at the optic chiasma. I repeat, they terminate at the optic chiasma by giving out two branches, the middle cerebral artery and the anterior cerebral artery. Now to give you a quick orientation of the figure, this is the right cerebral hemisphere and this is the right cerebellum, the left cerebral hemisphere and the left cerebellum. And you are looking at this network from an inferior view. You can think of this network as a stick figure, or as I like to remember it, an alien on the brain whose name is Willis. Now, the head of Willis lies on the cerebral hemisphere, the belly of Willis lies on the belly of the pons, and his legs, forming an inverted V shape, lie over the medulla and the vertebral column. Now, the head of Willis, called the circle of Willis, functions as sort of an insurance policy for the brain. So if one of the major arteries supplying the head gets blocked, the circle of Willis provides for various alternative routes for collateral circulation. The head of Willis is formed of three major pairs of arteries, all of which supply the cerebrum. These are the posterior cerebral artery, the middle cerebral artery, and forming the antenna of Willis, the anterior cerebral arteries. Now the belly of Willis, which lies over the belly of pons, is formed of the pontine branches and the midline basilar artery. Now his legs, which form an inverted V shape, are formed of the vertebral arteries. Now, between his legs is the anterior spinal artery. Now, like we had three pairs of cerebral arteries, we also have three pairs of arteries which supply the cerebellum. These are the superior cerebellar artery, forming the hands of Willis. This guy right over here, the anterior inferior cerebellar artery or the ICA, and this guy here, the posterior inferior cerebellar artery, the pica. Now the offshoots that you see here are the posterior spinal artery, which can either arise from the pica or from the vertebral artery. The interior part of Willis's head is formed by the internal carotid arteries. Let's look at the blood supply of the individual parts of the brain. Now all the arteries that lie over the belly of Willis supply the pons. These are the superior cerebellar artery, the pontine branches, and the eye cup. Now all the arteries that lie over the medulla and the vertebral column are the arteries that supply the medulla. These are the ica again, the pica, the anterior spinal artery, the posterior spinal artery, and the vertebral artery. I'd just like to give you two important points of clinical relevance here. The artery that gets affected in the medial medullary syndrome is the anterior spinal artery, and the artery that gets affected in the lateral medullary syndrome is the pica. Hence, the lateral medullary syndrome is also called as the pica syndrome or the Wallenberg syndrome. Let's look at the arterial supply of the different surfaces of the cerebral hemisphere. Figure A shows the superolateral surface. About 2/3 of this surface is supplied by the middle cerebral artery as marked in blue. Figure B shows the medial surface. Most of the medial surface, that is the anterior 2/3, is supplied by the anterior cerebral artery marked in pink. And the occipital lobe is supplied by the posterior cerebral artery marked in yellow. Lastly, figure C shows the inferior surface. Most of this surface except the temporal lobe is supplied by the posterior cerebral artery marked in yellow. Another point of clinical relevance is the berry aneurysm. Berry aneurysm is the weakening and dilatation in the arteries that form the circle of Willis. Now when these aneurysms rupture, they can cause a subarachnoid hemorrhage, the symptoms of which are sudden severe headache, nausea, vomiting, drowsiness and/or confusion, and the patient can also come with visual abnormalities. Let's move on to the venous drainage of the brain. The veins of the brain comprise of the cerebral, the cerebellar, and the veins of the brain stem. Now, the veins of the brain run mainly in the subarachnoid space and they do not follow the arterial pattern. They drain into the intracranial dural venous sinuses, which eventually drain into the internal jugular veins. The cerebral veins are divided into two groups, external and the internal cerebral veins. The external cerebral veins are further divided into the superior, middle and inferior, which drain the external part of the cerebral hemispheres. The internal cerebral veins are paired, that is, there is one on each side. They are formed by the union of the thalamostriate, the septal and the choroidal veins. Both the internal cerebral veins unite to form the great cerebral vein or the vein of Galen. A clinical scenario you should know of is the subdural hemorrhage. The cerebral veins pass through the subdural space before draining into the dural venous sinuses. Here, they have very little support. Hence, they can be torn following even moderate head trauma. The veins that are most commonly affected are the superior cerebral veins when they enter the superior sagittal sinus. The cause is usually a blow on the front or back of the neck. Consequently, the cerebral veins in the subdural space, called the bridging veins, are unduly stretched and torn. This leads to the formation of a subdural hemorrhage. That's about it for the blood supply of the brain. I hope this video made sense and that you enjoyed it. Hit like if you did. Bye!